Wisconsin Governor Scott Walker, he's pushing a bold new plan that would force welfare recipients to be drug tested before they get Medicaid benefits. If the law passed, it would make Wisconsin the first state to require this kind of drug testing and set up a precedent here for future nationwide reform. I do want to clarify, though, that it's not as though if you're on drugs, you have no possible chance of getting health care, but you would be asked to start some kind of treatment program. I want to go to Fox News' Mike Tobin, who is live in Madison, Wisconsin, with the very latest. Explain it, Mike.
Well, and that's a key element of this, Trish. This is a proposal, as you mentioned, that could very well set the standard for states across the nation. And Governor Scott Walker says the idea here is to get people who are on Medicaid into the workforce, where they would likely be required to pass a drug test.
I think most of us believe that public assistance should be more like a trampoline than like a hammock. And really, for those who are able to work, we should enable them to get back in the workforce.
Now, opponents argue the poor are being singled out. You end up spending money on drug testing instead of treatment, and you get arguments that it won't discourage drug use. It will discourage poor people from seeking medical help.
We think this would be a big step backwards because it approaches drug addiction as a moral failing rather than as a disease.
Now, Trish, as you mentioned, a key element here is that someone who tests positive for drug use doesn't get thrown out of the program. They get rolled into an addiction treatment program. The only people who would be refused medical treatment or subsidized medical treatment would be the people who refuse drug testing. Now, this measure would need to be approved by the Trump administration. It'll be sent to Washington at the beginning of next week, and it will need to pass the Wisconsin legislature as part of the overall state budget. A spokesman for Walker says he's got a comfortable margin with the votes there. Also, expect a court challenge. Trish?
All right, Mike Tobin, thank you so much. Evan Siegfried and Jose Aristimuño are back with me. Jose, do you have a problem with this?
Look, this is crazy. You can't deny people medical coverage, Trish, simply because they have an addiction. Because let's be real, if they have an addiction, they're not going to tell us that they want to get tested.
You're saying, hey, you got to go to some kind of treatment.
They're not going to go. They're not going to want to get tested. They're addicted to drugs. Of course, they're not going to admit it. Like, it's logic.
But shouldn't we be helping people to help themselves? In other words, why is we as a society want to encourage horrific things like addiction? Shouldn't we be saying, hey, guys, we'll help you get better, we'll help you take care of this, but you gotta have to want to do it, right? As a country, we have to want to start laying down a law here and saying, you know, enough is enough. Let's get people better. Let's get them healthier. Let's not just give them handouts that they can't do anything with, Evan.
Sure, but that's not the way to do it.
Hang on, Evan first, and then back to you.
If this were a bill which we're saying we just want to point the finger and say you're a drug addict after we drug test you, I would be against it. But this actually says we will still give you coverage and we'll actually help you get into treatment programs. Why are Democrats opposing treatment programs for people with drug addictions beyond me? Also, it's a fiscal thing because it is the state that's paying for the state Medicaid, and they're trying to find the problem early and take care of the problem now. Drug addiction is considered a mental illness by the National Institute of Health, and we have every responsibility to help.
You know,
but if the longer you go,
Jose,
the more
that
it
you want
costs.
to fight this is almost preposterous to me, because what the government here is trying to do is help people that have addictions and start setting up some parameters, and you just want to keep on going with those handouts, thereby encouraging. No, don't laugh about this, because this is serious. We have problems with opioid addictions in this country, and something has to be done about it. Yet you just want to bankroll them and say, okay, fine, keep it going. Doesn't somebody have to stand up and say enough is enough?
What I'm laughing about, Trish, is that your guest says that drug addiction is a mental illness, which it is.
The National Institute of Health says it is.
I am agreeing with you, but which is why they're not going to admit that they want to get drug tested. Like, let's be real. It's not going to work.
That has no correlation with what you just said.
Come on. You can't.
Facts are facts, not things you pull out of the air.
No, wait, let me finish my point. We cannot put together, marry a condition, a disease, okay, that they have on getting health care. That's unconstitutional. I promise you, if Governor Scott Walker gets his way in Wisconsin, this is going to go all the way, maybe to the Supreme Court. We don't know, because this will be the first state that happens. This is unconstitutional. It's not going to work.
I want to follow your logic. You think taxpayers should be shelling out their hard-earned money to people who are on drugs yet refuse to get any kind of treatment for it? I mean, that just is bizarre to me, Jose. You got to start putting some parameters up, and it's horrible. Addiction is a terrible, terrible thing, And we need to help these people. And effectively, you're standing in the way of that help, saying we're just going to continue to allow them to spiral downward. Things do need to change. I think Wisconsin's coming up with a rather innovative solution. We'll see where it goes. Evan, Jose, thank you so much.
Thank you.